Hey guys, Manu, Kalia, physical therapist and herbalist. So today I'm going to show you a technique to improve your knee bending. I've shown a similar technique in the past, which is more in a weight-bearing position. So for those of you who can't stand or put pressure on that knee, this is an effective technique to get your bending back, being able to bend your knee again. So what we're going to do is, basically, we're trying to address the rotational component of the knee, which it can be missing. So part of the bending mechanism is a little bit of internal rotation of that tibia. This is your tibia, this is your femur, your thigh bone and your shin bone. So what we're doing is you're going to grasp here and you're going to be rotating that inwards, or medial rotation. There's a little bit of medial rotation, that's all you're doing. And the second part we're going to do is you can use your other hand and you're going to work at doing a posterior glide. I'm gliding this. So basically I'm going to be gliding the lower bone, your tibia, onto your femur. So in a straight downward direction. So I'm going to do this laying down so you can see, but I wanted to show you guys what this is going to look like. It's a little bit of rotation, possible glide with the other hand, and then I'm working at bending that knee. So the way you're going to do it laying down is you're going to take advantage of gravity. So basically what's happening is this is what needs to happen. And let's say you're restricted, you can't go anymore. So one thing you can do is you can work at holding on. So put your heel of your hand here, your fingers are in front towards the shin. I grab with the other hand, do a little bit of rotation, medial rotation, and I let that knee drop down or that foot drop down, trying to get that bending back in that joint. So you can go further and further. Now the second part is, with the other hand I can always place right about the shin, and I can do a little bit of a glide down. So you're not rotating, you're not pulling it down, you're gliding it straight down, and you're doing a little bit of rotation, and then you work at bending it. Okay, so work at those positions, and this is again in a non-weight bearing position for those of you who don't tolerate standing or in weight bearing positions, this kind of a self-mobilization technique. So what we're doing a mobilization with movement technique, where I rotate and I let that drop down, might hang out and stretch and end range and might come out of it. Okay, so hope that helps. Try it out, and you're going to spend do about 10-15 times initially, just to gauge it, see how it feels. Does it allow you to get some of your bending back? And if it's helpful, you can increase the number of times you do that. And you can do that every day. Now keep in mind, if it causes you pain or the joint doesn't want to go any further, it feels locked, you don't want to do that technique. Okay, it's a pain-free technique. You might have a little bit of discomfort, some stiffness, soreness, that's different. But what you don't want is where the joint is restricted, it's not going anymore, or it gives you sharp pains, or it's locked up. So then there might be some other stuff going on in that joint. You might need someone else to look at it for you, a physical therapist. So I hope that helps. Leave a comment if you have any questions, and subscribe to the channel, and check out the site, there's lots of info on it. Thanks.